Okay. I hope you hear me well, friends. Everything is okay. So we're going to talk today, and we are going to practice today about the subject of bioenergy, pranayama, and practical techniques. Now, some people regard pranayama as bioenergy, which is commonly true. We spoke about that last time, that in many cultures that are connected to energy healing, there is an understanding that there is something beyond life, which is this kind of prana or bioenergy. And we're talking about how does it affect our life? How does it affect our being and our health? I'm going to describe today a model that was formed by a Muslim doctor from Israel. His name is Dr. Nader Butto, and he's a cardiologist working, a very famous one, I must say, working in a big hospital in Tel Aviv. As I say, he's a Muslim from Israel, and he has his special view about the connection between bioenergy and crises that are related to energy and diseases. And he uses his experiences as a doctor that was working as a general doctor and a cardiologist. He studied in Italy and in Israel and in Europe in a big hospital. And he has his theory. What's interesting there is that, first of all, he takes things that we. Sorry? Yeah, you're open to any questions. You can just raise your voice. Kavita or everyone. So he was using his understanding and experience as a doctor with his medical and you can say his medical knowledge to set some kind of a theory about that. And he is giving a lot of examples from his day-to-day life in the hospital for many years about this special connection. I have to say something special there, which is a kind of a disclaimer he's my doctor for many years. He's my doctor, he's my teacher, and I know him for many years. He's really very well known in Europe and in Israel. He teaches this kind of subjects, and his theory is very interesting because he really combines it with actual work. Like he has his experience and he's working with patients, and it really helps to understand the connection. Another disclaimer is that you have to be very careful with many theories, even if they are proposed by doctor, even if they are proposed and backed by science, because things are much more complicated and not straightforward as we might think. And so what I'm going to just explain or show right now should be taken in a bit of a care. Just watch it, see it from the outside, think about it, see if it makes sense to you. And just in order not to make it very like technical, we are going to speak about how can we apply some of these understandings to our life, to our yoga practice, and to our day-to-day living. Generally, his model says that emotional shock makes or constitutes energy imbalance and then targets organ damage. He says that he noticed that some diseases that is called to cure, and we know that there are a lot of advantages to our Western medical services. We can call it as the modern medical service or science-based medical services. One thing is they do that they know how to treat emergency very well. So if somebody comes to the hospital with symptoms of heart attack, he's not going to be treated directly, with Ayurveda or yoga or whatever, because he has to be living. Somebody has to save his life. But when you come to investigate what's happening with this person, how did it come that he had this kind of a disease? Is there any other connection except what we know from modern science? And let's take the example, for example, of somebody who has an heart attack? Is it only because he had all the high BP and high cholesterol annual, or are there some other things? So this is his model. Once again, take it with consideration. He says that fear of survival has an impact on kidneys and adrenals. Fear of survival has an impact of kidneys and adrenals and what can be related to them. He's saying that lack of support in life and criticism as well has its impact on the large intestine. Grief and sadness are connected to lungs. Anger and frustration are connected to liver and gallbladder. Worry and overthinking has some connection to stomach, spleen, and pancreas matters. Fear of attack, skin, and immune system. Powerlessness can be affected and seen as on the muscular system. Emotional shock can be affected on heart and circulation. He is talking more because he's a cardiologist about separation, death of close ones, crises of the personality. And I was preparing this talk today, and I got a phone call on Friday evening from wife of a friend, and he's a good friend, and she told me, he passed away. Suddenly he passed away. I saw him a few weeks back, and I told him, you have to eat more. You look very, very stressed. His mother died a few weeks back, and he had some personal matters. He was a very busy man, a lawyer. He had a big office, and he just passed away from heart attack. And I was remembering, I don't know whether there is a straight connection. I always remember this kind of understanding that behind this heart attack and this death or this disease, there might be some other challenges that we should know and think about. When people can go to doctors, do them some checks, they're going to be okay, and they're going back to life, to their way of living, and then suddenly something unexpected happens. Identity conflict is connected to liver and hormonal matters. Difficulty of letting go can be connected to colon. I think this is very common because we know about this. People that are really hard on themselves and they can feel it, like sexual trauma can be connected to reproductive organs. Boundary violation is connected to bladder matters, and overburden can be seen on back and spine issues. Do you want to I mean, does anyone here wants to reflect on the matter, knows about it, thinks about it, has some personal experiences, or it does seem like very, very unconnected what I just said now? Kindly share. What do you think? Does it sound familiar with some things that you know about life or you noticed? Okay, I'll continue. We have a yoga teacher who's not familiar in India, but he's familiar in Europe, and his name is Selvarayan Yesudian. Maybe he was the one that really brought the Hatha Yoga to the West. He was an Indian doctor from South India. He studied medicine, and he came to Budapest in the 30s of the last century, and he was going there in order to complete his medical studies. And when he came there, he started teaching yoga, and he has his idea about a connection between mind, body, and what we call as energy or prana. He was talking about things that today in modern yoga we regard as very common, like that every motion produces a specific pattern of muscular tension, a breathing change, and energetic contraction. We know about that, right? He was talking about persistence of negative emotions that disturb the life force, prana, and he was writing about this in the 30s. He was talking about blocked prana that weaken specific organs, like Dr. Butto explains. And he was talking about a connection between the weakened organ becomes susceptible for disease because of the lack of prana. And his understanding is that restoring harmony heals, like through a breathwork, mindful movement, relaxation, and cultivating positive attitudes, prana flows again, and the weakened organ remains strong or retains its strength. Okay. The thing is that Mr. Butto, Dr. Butto, talks about something really different. Of course, in general, we can say that harmony balance, but the ways restraining energy or balancing energy is a big question, and we don't know how can we do it. Like we have our yogic attitudes toward the practice that is, hatha yoga is not a physical practice, even though we use it very much. It's all about balancing energies. But what is the way that makes these practices work for us? Or how can they support generally? So he's talking about crisis during time. During time, he's also talking about past life. But anyway, he's talking about a crisis, an emotional crisis that happened or somebody suffered from during his life or past life, and this was the start and the cause for an emotional crisis that caused the physical disease. As you saw in this chart, it's not a theoretical thing. He is trying to say whether on what happened that made this person come to him as a cardiologist or come to the hospital or suffer from a specific disease. And what can be done in order to cure him is to tackle the original cause. But how can we tackle? How can we do that? And how can we work through life with it? Because let's say that we know all these things, and let's say that we believe in that, and let's say that we have some examples and they sound logical to us. What can we do? Because crises happen. Like we are all having some crises, emotional crises during life. And of course, we had them if somebody believes in past life, so we had them in past life. What can we do in order to work with that? And his proposition is to process emotions, to express emotions, to make our feelings, pains be expressed using various ways. He says that when our emotions are being processed, expressed, and not being shut down inside ourselves. There is a phrase I'm asking some friends, mainly from India, how are you? All good. What's going on? All good. And, all these all good people are always nice, but because, okay, they don't want to fall on you with their problems. But in the end of the question is, what do we think about ourselves? Do we really recognize that we have any kind, or we had any kind of an emotional stress? And yogic attitude, yoga, not hatha yoga, but when we are coming to yoga therapy and to yoga in general, we are talking about AVAV. And we will see today how Vihar and Vichar interlinks with the theory of that we talked now about the connection between imbalance of prana and disease, and how this is a very, very important off-mat practice that we can take into our daily life and make ourselves happy. Now, it's nothing new, by the way, because yogis, at least from the place where I studied during the last 15 years, we're talking about these subjects of Vihara and Vichar. This is one part of four pillar of a recipe, if you can call it like that, of yoga therapy. And so Vihara and Vichar is a way to solve or to work or to maintain our health using yoga. Can we explain that? Do you want to, does somebody want here to tell us what he understands about VR and Vichar? Do you have any clue about this? I know Simon has, but do you have friends? Or do you want me to explain it from scratches? Friend, I'll be happy if cameras will be on. It's very nice to talk with everyone here and to see them, we're okay. So I'll shortly explain Bihar and Vichar as a tool to work with balancing energies and keeping our health. So Vihar, in general, it talks about recreation and relaxation, in finding the time in order to have time to relax. Relax, express our feelings, talk about and view our emotions, have times with friends and family in nature, have time in expressing art, singing, writing, whatever thing that can make our emotions be processed. Now, it's very important. It seems like something that is separate from life. We have many other things to do, and even from the AVAVs, it's like maybe it's considered like one of the less important matters. But due to the experience of the connection between imbalances and emotional imbalances that are not processed, so VR is very important in order to keep our let's say our crises not spreading or not leading to pathological things or to diseases, and just letting them be expressed. And if crises from now, from the present or from the past, can be expressed, it can be very, very easy for us to try and solve our problems. I came once to a lady. She had problems with breathing, and I was asked by a family. She was like connected to some breathing machine, and she couldn't breathe. She has some lung deficiency, and I was asked to help her to breathe. Of course, they're asking the yoga teacher to teach somebody how to breathe well. It seems like normal. And then I came to her, and we started, technically working on the breath. And then I saw a picture. There was a picture on the wall, and I asked her, "Who is this boy on the wall?" And she told me, he was my son. He passed away 30 years back. And I just I didn't say anything. I just gave her the stage, and she started speaking, like expressing her feelings. And her husband from the other room said, "No, we are not talking about this in this house. No, 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 please don't talk about this. She cannot talk about this. You don't have to talk about this." And she was like in it and starting to tell me and to talk and to talk. And then she disconnected herself from the breathing machines, and she started breathing normally. She was just expressing her feelings, and just after 10 minutes, she was just breathing normally without anything, no yoga there, just expressing her feelings regarding what was shown in the model, that separation crises are related to lungs. And then she was breathing, and through the whole session, like about 30 or 40 minutes, she was just speaking. I wasn't saying anything, just listening to her. But her husband was really furious. And he came at the end. "This is no yoga. You don't have to come anymore. I don't want her to get excited. She's an old lady. She can't breathe, but anything." Anyway, this is an example how really Vihar, when it's done, think about it. If you are not getting into a crisis and you don't have any lung disease, but still you have some way that you take care as a discipline, as a practice of yourself, to express your feelings. Whether you speak with friends, you go to nature, you sing, you write, you draw, you chat, whatever, but you let your feelings be expressed. This is really a medical tool. Uh, Now, which are attitude. This is something complicated because we have all the values that we want to take into our life, and we want to be like a little disconnected, and to practice vairagya, and we have to remember all this as well. and let always this attitude-based tool be on our heads, and try to practice is to be better students and better people in life. Like take all these values and these strategies, or maybe as Dr. Jaidev used to call them, these techniques that can help us live our life better. In some ways or another, this can help our health. Not talking about the other things, but this is really essential to our ability to tackle medical issues, or not to let medical issues be there or less be there. If you have this kind of Shakti Bhava attitude, if we are a little detached from situation, if we can like see ourselves like sitting a little outside watching the movie of our own life, and not be so much involved in our even in our own situations, not to talk about the others. In one way be connected, in the other way not be emotionally burned out by this situation. This is the thing that is really important for our health. And we have to remember this, because when we speak about what yoga does to us, people speak about what asanas did, which are, of course, they're doing and they're helping, and about pranayamas, but this way of living, of vihar and vichar as a way of life, something that we take into life, and that we can take as well when we come into crisis, trying to help ourselves, our family, our friends, our students, tackling problems, they can be really, really, really essential. And beside eating sattvic diets, which are important, and trying to do many things with our physical body, we have to take this, I think, we have to take these two attitudes and take them into life. You know, I'm not so young, but not so old. I'm teaching for 25 years. I'm a student of Dr. Butto, and he's not my yoga teacher, because I had another yoga teacher, and he passed away now, and all his students are my students now. And anyway, they were both emphasizing all this, like we're taking the whole thing of yoga, not just something technical that is done in the beginning of an asana class and then at the end of an asana class, and then it should help you, but as a general or holistic attitude towards life, and reminding ourselves that working with this energetic, more prana-based bioenergy attitude. Bioenergy is what Sri Yogendra did, the founder of some of you know about the Yoga Institute in Mumbai, which is one of the first, or even the first yoga schools in modern world. And he was calling prana bioenergy, and he was talking about being aware of this prana as a tool from many years back. And I think we should adopt it a bit, and in our life as students and practitioners of yoga. I spoke too much. Do you have anything to say, friends, or to ask?
Yes, Tal, I wanted to thank you very much for bringing this up, because about a year ago, I found a book that goes in the same direction, that basically two German doctors, one allopathic doctor and one psychologist, they had a similar approach. They looked at illnesses and they said, where are they really coming from? And they didn't only look at emotional states, but in the larger also basically psychosomatic. So it's wonderful. And since reading that book, I have been practicing this on myself, and it's always right on. You know, whenever there's a conflict, I know my body will react in a certain way, and especially conflicts, right? It's inflammations in the body. So there may be states when we have a lot of pimples in the face, something very simple, but it actually means there is a conflict with someone or with something, right? And it's been life-changing and a real eye-opener. So yes, very thankful that you're bringing this up, and good to know. I will check out the doctors that you mentioned as well, and keep on reading further on this. Yes.
Yeah, I can agree with you, Simon. This really helped. I practice it myself, and I can even, for example, I have two boys. For the bigger one, I have a specific stomach ache. I don't know why. I can imagine, but I know that when I have this kind of feeling, it is something that has to be connected with him. And then I go on thinking about what's going on here. And it really brings the understanding that, of course, it's nothing like one-to-one, because some things we don't know. But of course, it gives us the understanding about how we are connected, how things can be done, how can we try and solve things, how things can be tackled, and it makes you more involved. And in the other hand, you are getting some more scientifically about situation, and have the ability to be a little disconnected sometimes, because it happens and you feel it because he's your son, but otherwise it is his life. So we have to see what we are doing there. And thank you for saying everything before. Some other questions or remarks, friends? Okay. So I think we understood the subject. Remember Vihar and remember the subject that we're talking about and let's try and practice them in life, and see how we can really think about emotions, use them, think about the connection between body and feelings, using the prana, the energy of life, in order to progress in solving our matters of health and psychological and physical matters. And let's take the AV&V model and Vihar and Vichar very much seriously, and practice it in life. This is what I can contribute this morning to all of us here. So if there aren't any questions, so thank you very much. Have a nice afternoon, and see you some other time. Bye-bye.
Bye-bye.
Thank you, Sim. Thank you.
Thank you so much, Dan.
Thank you.